tempo now, I would like to introduce our speaker, next speaker, Simon May from Flight Care Global. You'll be able to find his full bio at www.quaynote.com. Simon, I believe that you're joining us today from Sydney, Australia. So we're delighted to have you with us. Simon's going to be talking about telemedicine and business aviation in particular, focusing on medical support in business aviation, COVID and beyond. So Simon, I'm going to hand over to you with thanks. I think you've got a presentation to share with us there. So just let me know if you need me to do anything from this end, and we look forward to hearing from you.
Okay, many thanks, Lorna. Can you see my screen now?
Yeah, we can. That's fantastic. Thank you, Simon.
Okay, well, many thanks for the introduction. I think it's fair to say that the current pandemic had really raised awareness of health issues in aviation, and as the industry starts to ramp up again, we're seeing a lot of interest in health support across the industry. I'll start with a little bit about my background. I'm a physician, a doctor, a specialist in aviation medicine, and for over a decade have been providing support in management roles to various airlines. Most recently, I've spent time in the Middle East, providing support to one of the Middle East 3 airlines, but also to a large business jet operator and VVIP operation up there. Recently founded Flight Care Global and returned to Sydney. So what am I going to talk about today? Well, I'm going to say something about flight-related medical events and what we learn from where the big numbers are, which is really commercial aviation, and how we can extrapolate that into business aviation. I'm going to look at the parts of the journey where medical assistance is requested. And then I'm going to think about the question, well, why would I actually bother to have medical support or health risk management in my operation? And specifically, I'm going to dive down a bit deeper into that and say what drives different segments of the business aviation market to potentially consider having some health or medical support. I'm also going to look at what medical equipment could or maybe should carry on board an aeroplane. And also, coming back to the last talk, the use of technology, how technology is really revolutionizing this space, and specifically the use of technology to transfer passenger information to the ground and back again, and also the use potentially of enhanced telemedicine to enhance decision-making support when you've got a medical event evolving in a flight. So what about flight-related medical events? Well, the more people travel by air, it stands to reason, the more medical events are going to happen during, pre and post-flight. But more than that, as the population ages and we get better at treating chronic diseases, people travel more with diseases at an older age, and therefore that compounds the increase in medical events that can occur. Over the last 10, 20 years, we've seen continued annualized growth in medical events in commercial aviation and also business aviation. But what is specifically important in private aviation and VVIP operations is the process of traveling for medical treatment. So people travel to centres of medical excellence for medical treatment with conditions that might not be particularly good in an aeroplane. A good example there is, for example, people traveling from the Middle East to one of 4 places, so Frankfurt, London, Singapore, Bangkok, fairly long flights when they're going for fairly major medical treatment. And every day you will see medical events on those routes. Also, on the back of COVID, we're seeing increased awareness by operators, not only about passenger health issues, but also about crew health issues. But more than that, we also expect, as we emerge from the pandemic, to see more pent-up demand for this medical treatment. So people have been saving up their treatment and waiting to travel for treatment. So we expect a spike in flight-related medical incidences as we emerge from this current pandemic. What is this about the flight environment? It's not just like traveling in a car. The environment is relatively hostile. And there's a few reasons for that. The first is that a pressurized airline cabin or a pressurized business jet cabin is not pressurized to ground altitude. It's pressurized to a higher altitude. So if you look at a Global 6000, for example, that's got a cabin pressure altitude of 4,500 feet. A Boeing 737 or BBJ will have a cabin pressure altitude of up to 8,000 feet. The problem with that is it results in a significantly lower amount of oxygen in the air that you breathe in. Now, most passengers who are fit and well will tolerate that well, although you won't notice, but on an aeroplane, you actually breathe significantly faster than you do on the ground because of that lower level of oxygen. But you imagine someone with significant lung disease or significant heart disease in that lower oxygen level, it could tip them over the edge, and we do frequently see that. It's also worth mentioning that it's a low humidity environment that can exacerbate that low oxygen tension that we see in the atmosphere. Also, gases expand at altitude, or gases expand at cabin altitude even. That can be important, for example, simple things like tooth pain. So if you've got a dental abscess that's sitting there, you might not know about it on the ground, but there'll be a little bit of gas in there. If you get up to altitude, that gas will expand and you'll all of a sudden end up with severe tooth pain. And that's a very common cause of reasons for people seeking medical assistance on board an aircraft. But probably the most important thing is that it's a remote environment. You're always a minimum of 30 minutes away from the ground, and that's without an ambulance coming to meet the aircraft. So it's a remote environment, and that's always important to remember. What parts of the journey do people ask for medical assistance? Well, very commonly, there's three. The first is pre-flight. So somebody generally turns up on the aeroplane or at the airport or at the FBO and either declares a medical condition, asks for a wheelchair, for example, or they appear unwell to the crew. Now this, at the airport, generally if the medical condition is significant, then there's a good chance that the person isn't going to be able to take the flight. We get better at clearing people for flight the sooner people tell us. So the further away from the flight people tell us, we can do a risk assessment, we can provide some advice, and hopefully then the person can take the flight. And a good example of that will be somebody with significant lung disease who wants to take a flight. If they turn up at the airport and say, I've got really bad lung disease, and we're just about to put you in a low oxygen environment for 10 hours, then we're probably going to be a little bit uncomfortable with that. But if they let us know a day or two earlier, we could potentially say, well, actually, why don't you take some oxygen on the flight with you? And that will mitigate that risk of the low oxygen environment on the aeroplane. And with doing that, you'll probably be safe to fly. The second and probably the most important time when people call is during flight. So somebody gets sick during the flight. Now, in commercial aviation, this is relatively common. If we look at Australian data, there'll be an in-flight medical event on about 1 in every 40 flights. And that will be classified as an emergency on 1 in every 150 flights. And by emergency, we mean something has to be done to a passenger that wouldn't normally be done on a flight. So either a doctor has to be called or some unusual medication has to be given, or the aircraft ends up diverting because of that passenger. And then the final time is after the flight. And that's usually crew who've operated a sector, they get sick in a port that's away from their home base, and they require some medical assistance. And in business aviation, that's by far the most common time where medical assistance is called upon. Let's turn to the question, do I actually need medical assistance for my operation? Well, in commercial aviation, it's almost an operational requirement. The bigger the operator, medical incidents on the ground, so are a great driver of delayed on-time departure. So in the top 5 of gate returns and delayed on-time departure, but also diversions. 7% of in-flight medical events across the industry land up in a medical diversion with the inconvenience and costs that gives to the operator. In business aviation, this is going to be a little bit different because things happen less frequently. Medical incidents happen less frequently. So medical assistance is generally seen as more of an insurance policy. You need it when you need it. If we look at some high net worth individuals and VVIPs, they actually even travel often with their own doctor. And may say, well, I've got my own doctor. I really don't need anyone on the ground telling him what to do. But then we have to ask the question, is that doctor, who may be a GP, equipped to manage an event in flight? Do they understand the physiology of an airline cabin? Do they understand the limitations of an airline cabin? And we tend to see with doctors when they're on an aeroplane and they're not familiar with the environment, that their instinct is just get this aeroplane on the ground as soon as possible. And we definitely see that in commercial aviation, where if you let onboard medical personnel manage a medical event, the aircraft has a far higher rate of inappropriate diversion. But what is common to both commercial and private operations is that the operator is seen to have a duty of care to the passengers and also a duty of care to their crew. So that should always be forefront of the mind when thinking about, do we need to have medical assistance? Digging down a bit further into various sectors of the market, what about charter operators? Well, with charter operators, you've generally got passengers who are travelling for either business or leisure, but often they can pitch up with unknown or undeclared medical histories. And the impact that if they have a medical event on board, media coverage of a badly managed medical event and reputational damage, that could even follow on to litigation. Competitive edge is also important. If an operator sells themselves on safety and medical services as part of their offering, it can often be a competitive edge. And one of the things at FlightCare Global that we're looking at the minute is the ability to add services per charter, so ability to pay per use, if you like. So if somebody decides that on their flight, they want their flight to be covered by a medical service, that they can then pay extra for that to the charter company, and that can be one of the add-on services that the charter company offers. What about high net worth individuals, VVIP, and even corporate operations? Well, here the aircraft is generally reserved for use by the individual who owns the aircraft, also their families and business associates in the case of a corporate-owned aircraft. And really here, the driver for having medical assistance is the protection of the individuals, their families and loved ones. It's also important to avoid unwarranted diversions and panic in the face of a medical incident. So you imagine a Murdoch aeroplane, for example, that ends up somewhere it shouldn't be with an ambulance screaming towards it. That could have a fairly short, sharp impact on the News Corp stock price, for example. Also important to remember, as I said before, that accompanying doctors may be a little bit uncomfortable about managing a medical event on board an aircraft, may not have the equipment or the knowledge to know what to do adequately. Also, there often tends to be quite a large entourage traveling with specifically VVIPs, and they're the people that tend to get sick on the aircraft just because there's more of them rather than the VVIPs themselves. And the doctor may not be there for the entourage. So it's also important to be aware that accompanying people, even journalists, may get unwell on board an aircraft. What about the carriage of medical equipment? Unlike in RPT operations, there's generally no regulatory requirement to have medical equipment on board your private aircraft, with the exclusion perhaps of a first aid kit for oceanic flight. Important to say, on commercial aircraft, medical kits tend to be there for the use of medically qualified volunteers on board. Now, generally about 90% of flights in commercial airliners will have a medically qualified person on board who can put their hand up and help during a medical event. We usually don't like them to run the medical event. We usually like them to talk to the ground and be the eyes and ears of the clinician on the ground who's helping out. But they're there, and nonetheless, the stuff that we put in a medical kit on a commercial airline tends to be focused to used by medically qualified people. In business aviation, it's generally the cabin crew. So we need to put on equipment and medicines that can be used by crew with guidance from a ground-based medical service, GBMS. Also important to notice that we've now, with technology, got enhanced telemedicine and monitoring. So we can take an ECG, for example, on board an aircraft of a patient with chest pain, and that can assist with decision-making in these very rare emergency situations. So actually, do we need to get this craft on the ground quickly, or can we potentially continue to the destination? It's also really important to mention defibrillators. Remember, a business jet flying at 51,000 feet is in a remote location. It's minimum 30 minutes from a diversion port and a defibrillator. You've got about 4 minutes if someone has a cardiac arrest to get them defibrillated if they're in a shockable rhythm. So defibrillator is something that I always recommend that people carry on board any type of aircraft. What about technology? Well, at Flight Care Global, we're very keen on technology. We've developed a technology platform for managing medical events in aviation. Important in business aviation is that reliable internet and faster internet connectivity is becoming the norm. So therefore, we believe it should be easier and more rapid to get medical decision support in the air and on the ground in effect. We have the ability, as I just said, to stream passenger vitals and enhance passenger information. But one of the things that we've done with technology is for the more minor things that are commonly asked for in flight, we've actually used some machine learning and artificial intelligence to guide the crew. So sometimes for very simple stuff, you can log a case and actually you might not need a clinician because the system or the app that we have can provide information to the crew and treatment and decision support information. All this use of technology actually should reduce the cost of access to these services, which in effect in business aviation is pretty much an insurance service. Also, as a medical provider, technology allows us a few advantages. When our doctors and nurses are looking at a case of an aircraft in the air, if we use technology, we can have all the information about that flight in front of us on one screen. So we know where the position of the aircraft is, we know where any alternate airports are in the case of a diversion, we know when it's due to land at its destination. We can also see the medical equipment that particular operator has on board because that's all stored in our system. We then overlay this with passenger medical information to allow a more accurate and timely medical advice. The other thing about using technology, especially if you're using text-based technology or text-based communication, is that you tend to get faster, more dynamic, and importantly, accurate recorded communication between the ground and the aircraft in these events. Just from our last slide, I just wanted to show you how we brought all this together. So technology platform for medical events in aviation. You'll see across the top there, we've got the three situations where we said people call for assistance. So pre-flight, in-flight, and at the destination, which is usually crew, and how we've integrated that with a virtual call center. So traditionally, all this stuff was done over the phone with a doctor on the end of the line, but by using global intelligence, artificial intelligence, and technology, we can run this almost Uberized, if you like. We can run it remotely. So that gives you a good picture of how this can be done. Also important to mention, just see training at the top there. If you're using medical support in flight and pre-flight, it should be part of your crew training program, as should any medical equipment that you carry on board. And that is where my slides end, Lorna. So any questions?
Thank you, Simon. Well, actually, yeah, that was very interesting. Thank you very much, very insightful. We do have a question, which you may be able to see. I'm just going to read it out here from Maxine Skikluna. Hi, Maxine. She says, we have seen in the news transport of COVID critical ITU patients between different countries. For example, the German Air Force has an ITU equipped aircraft capable of catering for a number of ITU beds. Have we seen advancements on this aspect due to COVID? Any other comments on this topic, please? She asks.
So there's two very important things about transporting people with COVID. The first is when someone's critically unwell, the normal procedure with personal protective equipment and things will apply. So there are, and particularly in Germany, even Lufthansa has had these kind of patient transport units, which can be segregated from the rest of the cabin. But generally, when someone's critical and on a ventilator, they're on a closed circuit anyway. So if you apply general precautionary measures and clean everything frequently and wear personal protective equipment, the risk is actually relatively low. Mm. The other thing I want to say about COVID is if someone who's not critical with COVID is traveling on an aircraft, the risk of transmission from that person is actually really low. In fact, exceedingly low. There's been a number of work done around this by both the International Air Transport Association and also by some of the aircraft manufacturers. And the risk of transmission on board an aircraft, especially if the passenger is wearing a mask, is actually no more than being socially distanced in an indoor setting on the ground, despite what you might think. And that's because of the way that the air flows on an aircraft. It doesn't promote lateral spread, it doesn't promote front to back spread, it's generally ceiling to floor. And also many aircraft, including many business aircraft, have hospital grade filters in there as well. So you might have read a little bit about this in the news, but actually spread on aircraft is actually very, very low risk.
Mm, mm. Well, that's interesting to hear and reassuring as well. And I'm just wondering, Simon, is there any kind of research on the cost to operators and charterers of not having medical assistant plans in place along the lines that you've described? I just wonder if there's a sort of kind of cost benefit analysis that's been done on this.
It's generally softer in business aviation, so it's those intangibles like reputational damage, and like care for your high net worth individuals or your senior executives. But if we look across to commercial aviation, I've seen diversions of aircraft that have cost upwards of $1 million just for one sick passenger who wasn't very sick, who didn't need to be on the ground. The other thing to mention, of course, is the litigation. If you don't divert and someone is really sick, that is the worst scenario. So if somebody dies, for example, and I've seen this in my 10-year career doing this, if someone dies on an aircraft with a condition that should have been on the ground earlier, then you could be in for a very big lawsuit.
Okay. So get your plans in place. That is the message, isn't it?
Yeah, absolutely.
Okay, so I think we don't seem to have any more questions, Simon. Is there anything else that you want to add to your presentation there? I mean, that was quite a good summary of the current situation and what's going on with COVID, but also other conditions as well. Is there anything else that you want to add there?
No, I think just be aware that as we emerge out of the pandemic, there's likely to be a spike and a continued interest in this. We're seeing operators that have never had medical support before, as they restart operations and they're ramping up again, they're starting to think about this stuff. So there's a lot of interest out there. So just bear it in mind.
Excellent. Okay. Well, look, Simon, thank you very much indeed for joining us today. I really have no idea what time of the day or night it is where you are. What is it now?
It's just approaching 9:30.
In the morning, is that?
In the evening, on a rather muggy, hot Sydney evening.
Oh, okay. Oh, well, that's quite civilized. That's not too bad, is it? Yeah. Still got the remnants of an evening to enjoy. But as I say, thank you so much for taking the time to join us today. And for that update, that's very interesting, and I hope our paths will cross again sometime in the future.
Thank you very much,
we are going to get you to rejoin our audience, Simon, and if you've still got energy, you're welcome to join us for the rest of the conference, or at least for part of it.